Hi, Dr. Todd Sullivan from Nova Chiropractic and Acupuncture. One common question I get from patients is, what is osteoarthritis? So osteoarthritis is when the cartilage in a joint wears down from overuse and over time and pressure. So what will happen is when that occurs, that causes inflammation to develop in that joint, and it'll cause pain and stiffness. When we do treatment for osteoarthritis in our office, we're not removing the arthritis. Only a total knee replacement or a total joint replacement can actually do that. So what we're doing with our treatment is we're reducing the inflammation, which will help to reduce the pain and stiffness in the joint. So for example, if we apply laser therapy over the knee, it's going to help to reduce that swelling and that stiffness and help to improve the function of that area. And a lot of times we're able to help patients go several months without needing another treatment. And then what will happen though, because we're not removing that arthritis, it's going to develop again over time and cause pain. And some people will go a month, some will go 6 months or a year. And then they'll need a follow-up treatment and we'll get them better again so they can function. It gets to a point though where if it gets so irritated and so broken down that there's not much we can do. And a lot of times we refer the patient out for pain management or a surgical consult. But a lot of times we're able to help patients quite a bit and give them quite a bit of relief. The 5 most common areas we typically see osteoarthritis is 1, the spine. 2 is going to be your hands and fingers because we use our hands all day long. The next areas are going to be your hip, your knee, and your toes. So those joints, load bearing, get placed under a lot of stress, and depending on your body mechanics, it can cause the joints to wear down faster. The most common treatments we do for osteoarthritis, 1 would be laser therapy, and that's just a powerful anti-inflammatory, gets deep into the joint, helps reduce the inflammation and helps to improve that stiffness and range of motion. Then we also do a technique called dry needling, where that's applied to the muscles around the joint, and it helps to loosen up the muscles so it reduces the pressure on the injured joint. And then we can also do acupuncture as well. If someone has a very severe arthritic condition, a lot of times we can't even do some of these other techniques, and acupuncture is a very good non-painful way to reduce that irritation and to help improve the function of the joint. Finally, we'll also do gentle chiropractic adjustments to help restore the range of motion in the joint and help that joint function better. So if you have any questions, reach out to me at 703-912-7822, or you can schedule online at novachirowellness.com.